Hi again, I'm Ed Podlowski of Morningstar Actuarial Consulting. This is the sixth in a series of videos bringing insights into how large self-funded health plan sponsors can best assess the value propositions of health plan disruptors or innovative healthcare solution providers. Prior videos on this topic can be found at our website at morningstaractuarial.com. In those videos, we focused on the landscape of the innovative healthcare solution space and the issues that employers face in trying to understand their value propositions. We also then talked about the overall process that should be deployed that's truly a best practice. And then we focused on the first three phases of that process, being the current state assessment, which is where you identify those issues systemic within your healthcare population that are required for you to focus on for an innovative solution provider. We talked about the guiding principles and the development of those and how that builds consensus within your organization, as well as leads to a more efficient process and better decision making. And then in our last video, we talked about the metrics of success. So in today's session, we're going to start to cover the many valid approaches to evaluate the value propositions of health plan disruptors or innovators. Use of these valid actuarial methodologies, what plan sponsors should be looking for from their solution providers as support for their value propositions, particularly as you're evaluating them during the initial phase before implementation, but also the analyses that plan sponsors should deploy with their own data to validate actual savings. Now, some solution providers take care to capture client data and conduct analyses with the appropriate methodologies to support their value propositions. However, many either don't have access to data for analyses or don't believe the findings are worth the investment and resources necessary to obtain the required information. So as a result, plan sponsors need to be diligent in asking questions about the solution support of its value statement, including what data sources were used, what linkage the data source has to actual experience of their clients, and the validity of the study methodology to support their findings. The actuarial model to support the value proposition will depend on several factors, including availability of credible data and the type of solution being studied. A disruptor that targets specific healthcare services, conditions, or disease states likely require a different model than those that are more comprehensive in nature and affect all or most of the health plan services. In today's session, we're going to provide an overview of the comprehensive models, those more likely to be deployed for solutions that affect more than just a specific healthcare service, condition, or disease states. Methods to value solutions that affect specific healthcare services, conditions, or disease states will be covered in our next video. So really think of this as part one of two, if you will. So comprehensive study methods include randomized samples, historical or pre-post analyses, participant versus non-participant methods, geographical-based methods, and plan comparison models. Randomized sampling requires equivalent samples from the same population to create a control group and a study group, the study group being the one that's been exposed to the intervention or solution. Randomized sampling typically requires a large population, perhaps more than most plan sponsors have, and really these methods are used in more academic settings. I mention it here as it may be an alternative for solutions from large health plan administrators with access to numerous plan sponsored data sets. Now, historical pre-post methods are probably the most common, and they really compare results from the same population before and after the intervention, and thus provides greater assurance of similarities in a risk profile for comparison. The challenge with historical study methods is accounting for changes between periods not attributable to the introduction of a solution, like healthcare inflation, plan design changes, network changes, changes in administrator, etc. However, for actuaries, these challenges are not insurmountable, and these are the things that we do routinely for our clients. Participant versus non-participant methods compare the group who utilize a solution versus those who choose not to participate, who are not offered the service. These methods avoid the need to adjust changes between periods, but adds a significant complexity and need to adjust for risk factor differences between the population. So risk factor differences may include age, gender, disease state, geographical practice patterns, severity of illness or injury, and complex or comorbid conditions. Matched cohorts are one means to adjust the risk factors, but the population again would have to be quite large in order to produce a credible pool of members in each group. Now, geographical and plan comparison-based methods compare populations where the solution was introduced in certain geographies or plans against the geographies or plans where it was yet to been implemented, either by design, like a desire to test solution before a broader rollout, or as a result of other limitations. These models may require adjustments to normalize the cost due to difference in plan design, network, and administrators, as well as differences in risk profiles like we discussed previously with the participant versus non-participant models. The issues identified in the discussion don't necessarily disqualify the approach, but it is important to consider the most appropriate means to adjust the analyses and the sensitivity to any assumptions. Finally, multiple methods may be considered for any particular solution, which may help to support the conclusions from each analysis. So our next video, we're going to focus on the value propositions for solutions that address specific services, conditions, or disease states. If you can't wait for the next video, though, just go to our website at morningstaractuary.com and read the article that we have posted out there, which was published in the first quarter 2020 edition of Benefits Quarterly. You can find the article under both the solutions and articles sections of the website. Again, if you want more information, please feel free to reach out to me through LinkedIn or through the website at morningstaractuary.com, or you can even reach me via my email at ed.podlowski@morningstaractuary.com. I look forward to seeing you in our next weekly video.